All right, everyone, welcome back to the podcast. Today, we're diving into a really important topic, one that has the power to save lives and improve the quality of life for many. So, picture this. Imagine waking up and suddenly finding you can't move one side of your body. Pretty shocking, right? That's the reality of a stroke. It's frightening. Today, we'll simplify stroke management and physiotherapy. Let's break it down.
Wait, what exactly happens in the brain during a stroke? I mean, does the brain just stop working or something? That sounds so alien.
Great question. A stroke happens when the blood supply to the brain gets interrupted. Brain cells need a constant flow of oxygen-rich blood to survive. If that supply is cut off, those cells start dying, leading to various complications and maybe some serious permanent damage. Think of it like a garden. If you don't water the plants, they just wilt and die.
Wow, that's a really cool analogy. So, does that mean there are different types of strokes, maybe different ways the blood can be blocked or something?
Exactly. There are primarily two types of strokes, ischemic and hemorrhagic. Ischemic strokes, making up about 87% of all strokes, occur when a blood clot blocks a blood vessel supplying blood to the brain. You can imagine it like a dam blocking a river. On the flip side, with hemorrhagic strokes, a blood vessel ruptures, which leads to bleeding in the brain. Think of a burst water balloon. It's a complete mess.
Yikes. So, when someone has a stroke, is there always going to be blood loss? Or, I'm getting confused with the science around that.
Excellent question. In ischemic strokes, there's no blood loss, but the brain tissue is deprived of blood, almost like starving it. Conversely, with hemorrhagic strokes, there's actual bleeding, which can be more immediately dangerous. That's why it's so crucial to recognize stroke signs quickly. Remember the acronym FAST. Face drooping, arm weakness, speech difficulty, and the most important of all, time to call for help. Every minute counts.
Okay, so fast, got it. But what specific signs should we look out for, besides facial drooping and stuff?
Definitely. Other common symptoms include weakness on one side of the body, slurred speech, and even sensory loss, like if you were to burn your hand and lose the sense of touch. In a similar vein, strokes can mess with those signals, making it difficult to feel.
Oh, I didn't realize that. So, after a stroke, there's a recovery period, right? I'm curious about what happens to the person during that time.
Absolutely. Stroke recovery goes through various stages. First, we have the acute stage, where physiotherapy focuses on preventing complications. It's actually kind of like teaching a baby to crawl before they can walk. We prioritize comfort and positioning to prevent pressure sores and contractures, those unpleasant muscle shortening issues.
So, it's like when a puppy doesn't get up and move around, it can get stiff or something like that?
Exactly. Just like a puppy needs to stretch and move to stay healthy, stroke patients also need assistance to maintain their mobility. In this stage, therapists might do passive range of motion exercises to keep the joints flexible.
That sounds so crucial. But, what's the difference when they move to the subacute stage? Is it like an upgrade or something?
You could put it that way. In the subacute stage, physiotherapy gets more active. Think transitioning from a bike with training wheels to a regular bike. We introduce strengthening and balance exercises to really start rebuilding muscle power and coordination.
That's so fascinating. So, are there special techniques therapists use to retrain the body post-stroke?
Yes, indeed. Therapists often employ techniques like the bow bath technique to promote normal movement patterns and PNF, proprioceptive neuromuscular facilitation, to enhance coordination. They're like trainers for your body, guiding it back to its peak performance.
I love that. But what happens long-term? Like in chronic rehabilitation, is it possible for people to go back to normal or is it more complicated?
In the chronic stage, the focus shifts to improving endurance and daily independence. Patients practice walking outdoors, climbing stairs, basically regaining their overall quality of life. But rehabilitation can take a long time, and patients may face challenges like shoulder subluxation or foot drop.
Wait, foot drop? What's that? Sounds serious.
It can definitely be serious. Foot drop happens when someone struggles to lift the front part of their foot, which can trip them up. So, we focus on balance training to avoid falls. It's like training for a sports event. It requires resilience and consistency.
Wow, this whole conversation is mind-blowing. The attention to detail in rehabilitation is so impressive. So, how do therapists keep track of their patients' progress?
Excellent inquiry. They utilize assessment tools like the Modified Ashworth Scale and the Berg Balance Scale to monitor improvements. It's all science-backed, keeping everything in check, like a coach monitoring an athlete's training.
This is so enlightening. I had no idea it was this extensive. So, what can our listeners take away from today's discussion?
Just remember, stroke profoundly affects movement and function. Awareness, early recognition, and targeted physiotherapy can dramatically improve recovery. If you see someone struggling, don't hesitate. Call for help can make all the difference.
This has been incredible. Thank you so much for sharing all this knowledge. Let's keep learning and supporting each other in this journey.
Absolutely. Thanks for tuning in, everyone. Keep studying smart and treating better.